Dr. D. Anil Kumar, Pediatric Cardiac Surgeon in KIMS Hospitals in Secunderabad. I have with me a family who travelled from Sudan to Hyderabad to a hospital, to our unit in hospital in KIMS for the baby's heart problem. The baby is 3 months old and weighing about 2.8 kg when the baby came in first. So the baby had a complex problem in the heart called Truncus Arteriosus. It's a very complex congenital heart disease wherein in this problem the major issue is a big hole in the heart, a VSD. But that is not the that's not a major problem. The problem is the truncus means the tubes which come from the heart, come out of the heart are single. So normally from the heart, two major tubes come out. One tube called aorta takes pure blood to the whole body, and the other tube called pulmonary artery takes impure blood to the lungs. So the aorta or the pure blood artery comes from the left side of the heart and goes to the entire body, and the pulmonary artery, the impure blood artery, comes from the right side of the heart and goes to the lungs, both lungs. So unfortunately in this problem, both the tubes are single. That is, there is only one tube which comes out of the heart, that is called the common trunk, and that tube takes blood both to the body and to the lungs. So in other words, the lung tube, the arteries which take blood to the lungs are arising from the common trunk. So we must understand that any tube which comes out of the heart taking blood has got a valve. So normally the aorta has got a valve called aortic valve, and the pulmonary artery has got a valve called pulmonary valve. So unfortunately in this condition, because there is only one common trunk coming from the heart, there is only one valve, that is the future aortic valve. There is no valve for the lung artery because the artery is coming directly from the common trunk. So when we do the operation, we have to fix a hole in the heart, the truncal VSD. In addition, we have to separate the circulation, the tubes which go to the body and the lungs. That is, the circulation to the body and to the lung have to be separated. So this is a major operation, and when you separate them, then we need a tube with a valve to take blood to the lungs. So this is called a conduit. So this conduit, we usually use a biological one, and this baby's size is about 3 kilograms. We put a 12 millimeter size conduit. So the only downside of the effect of this problem is when the baby grows. The baby had a good operation, complete repair of the operation. Maybe it was done recently, and the baby is ready to go home, happily feeding well, gained weight in the last 2 weeks, and playing with the mother, and ready to go back home. The only downside about this problem, the baby will have normal life, but the baby, when the baby grows, the tube has to be changed at least 2 times in the next 30 years. So this is that is not a very major operation, and the first change usually will be done after 6 to 8 years, depending upon the condition of the heart. So this is so in a sense, Truncus Arteriosus is a complex congenital heart disease, wherein a common trunk comes out to the heart along with a hole called the VSD, and a repair of this involves an intracardiac repair of the VSD and separation of the circulations and the RV to PA conduit. This is what the baby had, and the baby is doing well. Let us listen from the family what they say.
بسم الله الرحمن الرحيم. طبعا جينا من السودان إلى الهند، وبالتحديد إلى مستشفى كيمس في حيدراباد. عندنا الطفلة عايضة تشكي من فيها إشكالية في القلب، وقابلنا الدكتور أنيل كومار وعمل لها العملية، والحمد لله تمت بنجاح 100%. ونشكر الدكتور أنيل كومار، ونشكر طاقم المستشفى بأكمله من دكاترة ومن ممرضين، وجزاكم الله ألف خير.